Treating obstructive sleep apnea is a very serious condition that surgery is definitely an option that we need to consider. Obstructive sleep apnea causes other conditions such as high blood pressure, obesity, and diabetes, and the big boy stroke. My father, unfortunately, passed away from complications from obstructive sleep apnea. He had a stroke and we lost him. And since his death, I've really devoted my career to understanding that disease. The treatments that are primarily used today, whether it's CPAP or maybe even an oral appliance, they're really just Band-Aids or treatments that try to overcome the problem. And I'm not saying that they're not successful, because they are, but we really aren't thinking about trying to cure the disease. When we talk about obstructive sleep apnea, the obstruction is really the tongue and the tissues in the back of the throat, because the underlying problem is the lack of growth of the upper jaw and the lower jaw. By the lower jaw and the upper jaw not growing forward enough, it leaves those soft tissues back in the back of the throat, and it narrows our airway. So patients have difficulty with breathing because of collapse of those soft tissues, because the jaws did not grow forward enough. So what we do with MMA surgery, or maxillomandibular advancement surgery, is we take the bone structures that are attached to the soft tissues that are causing the obstruction, and we move those jaws forward. So when we move the jaws forward, we're actually bringing the tongue and we're bringing the soft tissues of the palate forward, which opens the airway, and it gives us the possibility of a cure. Many of our patients that we treat with MMA have had CPAP in the past. And what they tell me is that even though they were being treated by CPAP, once they've had the surgery and they had their natural airway when they sleep much better. They feel much better. So if you suffer from obstructive sleep apnea, or have difficulty wearing your CPAP or can't wear a CPAP, feel free to call our office for a consultation today.